Hello, welcome to adaptnclex, and thank you for joining the channel. Is SATA question really hard? The NCLEX SATA question, are they really, really hard that you have to be afraid of? Stick around and see, and you answer the question yourself. I have a question for you. Think about it and see if you can analyze it and break it down and see if SATA question is really hard. And let's do it together. And then we use my method, the way we do it, and analyze the question. All we need to do is to break down the question and dissect it. Like I said all the time, dissect the SATA code. And this is the place where we dissect the SATA code. So to dissect it, you got to find what is being asked you. So what is our ask for this question? Read the last sentence. Which of the following assessment the next should expect? So we're looking for an assessment finding. So that is what will be asked. So our answer choice has to be an assessment. Then you look for your case. What is the case he's talking about? I don't know. They say I should do some assessment, but what kind of problem do we have? A client, okay, with the history of depression present to the emergency room with tachycardia after taking linezolid for skin infection. She was prescribed paroxetine 2 months ago. Which of the following assessment? So what do we have? You take your buzzwords into your case. So we have a depressive patient, okay, and we have linezolid as a medication. Patient has what? Tachycardia. And she was taking some SSR. I don't know what it is. You don't even have to remember the name, but if you recognize it, this is an SSRI. So what is the problem we have? We have a case of assessment, and then we have a case of depression, linezolid, tachycardia, and SSR combination. What are our buzzwords? We have our 4 buzzwords here. And then you rewrite it. Rewrite using your buzzwords. What is that? A patient with depression taking SSR now on linezolid with tachycardia. What assessment finding can we find? Once again, this depressive patient was prescribed SSR two months ago. All of a sudden, she's taking linezolid for skin infection. Now has tachycardia. You have broke down these long 5-line questions in the simple 4 words. In 4 words that you're looking at it over there. And then so you have rewrote the question. You've taken in charge of the question. And then when you rewrite, that is where you're going to make your choice. During your rewriting, come out with your content. Find out what is the problem. Stay 30 seconds. Give yourself 15 to 30 seconds and find out what is actually going on. We have SSRI plus linezolid. This is a bad combination. This is antibiotic. It looks like vancomycin. That is the PO form of vancomycin. You can call it that way. It behaves like MOIs. They do the same thing as the MOI. So if you're taking those, you have to take all the precaution like somebody taking MOIs. You see, I'm breaking it down, dissecting the SATA question. And what does the combination of SSRI and MOIs is for? They lead to serotonin syndrome. So we have serotonin syndrome here. What you see with serotonin syndrome, everything is up. Everything is supposed to go up, 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 up. You don't need to memorize all the symptoms. Then you take this content, you put it in the bag, carry it with you, and you go to the answer choices. You say, look, if I look at the answer choice, I'm looking into the bag and see if I can find something that is related to that. You treat each answer choice as independent. You don't compare, and you make a choice and you move forward. You don't compare and back and forth. So our bag of content now has SSRI and linezolid. And what it has led to, we have serotonin syndrome. And what do we say? Everything has to be up. Therefore, if each answer choice, no matter what it is, it has to be up. So you think about it and say, is it going up or down? Now, upper reflexia, well, there's a word upper there. I don't know what is reflexia. I don't care. All I know is there's hyper. Hyper is always up. So I'm choosing it. I'm not thinking about it, whatever reflexia is or not. I'm not going to explain it to you, but I see hyper where something is going to go up. So I'm choosing this. A tremor, when somebody is tremoring, is shaking, everything is up. So clonus, I don't know what it is, but when you have a clonus foot, usually your everything is go up. It's like really up, and when you touch it and you reflexes it up, it's like so stiff. Therefore, this is what we have. Hypertension, you know that there's hyper there. I don't care about the tension. All I care about is hyper. Hydrosis. I don't see some hyper there, but the word itself sounds like really down. Okay, hydrosis. So in serotonin syndrome, the patient usually they sweat a lot, sweating. This is one of the conditions. If you check my website, you see I label them and the hot guys: serotonin syndrome, malignant hyperthermia, neuroleptic malignant syndrome, and thyroid storm. They can put all these four together and confuse you. So I have a video about it. You can check it and you see. But they sweat, and they make a lot of sweat because of too much activity of the serotonin. So this sound really down. So this is not expected. Hypoactive. You see the word I told you, hypo sound. I don't know what is. I know active is a little bit high. Bow sound, I don't care about it. But I see hypo, then I'm going down. What have we done? We've broken the thing into pieces. We've like dissected. We've taken our content of bag and we use it to like hammer each answer choice and then make sure that it's responsible for this condition that we have. And then if it is, we're choosing it. If it's not, we just let it go and we don't compare any answers. So is SATA question hard? No, it's not hard. This question is all about assessment. Sometimes they'll tell you about risk factors. Sometimes they will tell you about what? Content, straight content. Sometimes they will tell you about what? Teaching, you're teaching the patient. So the same thing, you break it down. Don't rush through it. Sit down, get your bag of content, of risk factors, of bag of teaching, of bag of education, and then slam it with each question, each answer choice, and see if he will stand. If he stand, that means he's one of them. If he doesn't, he's falling down. And that is how you do SATA question. Take care of yourself. Check adaptnclex for more questions on select or that apply or SATA, and see you later.